Hi, my name's Alison Mann. Today's session on infection control was covering some of the more practical aspects of infection control in veterinary practice. So things like theatre practice, environmental cleaning, patient preparation for both surgical procedures and for intravenous catheterisation, and some of the ways in which we can reduce hospital-acquired infections in our patients that come to see us in practice. So we've kind of covered some of these things on here, just about kind of microfiber cloths are a potential good thing for cleaning. But just remember that laundering can damage the fibres, so you can't use them forever before you have to swap them out. Having standard operating procedures, which we've already kind of mentioned, but making sure that they are evidence-based. So you can't just make up a protocol off the top of your head. If you're writing standard operating procedures for your practice, you need to make sure that they are evidence-based. Now, with infection control, we can take quite a lot of information from what they're doing in human hospitals. There's some areas of vet med where we can't really take evidence from humans because they're quite different. But I think when it comes to infection control and things like cleaning operating theatres, I think there are some things that we can take from there. So if you look up hospital cleaning routines on the internet, you can get a real wealth of information on there that's quite easily transferable to what we do. Just going back to our operating theatres, when you guys were drawing your diagrams, there was some talk around bedding in theatre. So who allows bedding in their theatre and who doesn't? Do you all have bedding in your theatre?
Ours is case by case.
Okay, yeah. So what's the potential issue around having fluffy bedding in theatre?
Irritating surgical sites.
Yeah, yeah. Anything else? So vet beds and sort of fleecy beds always get fluff stuck to them, don't they? So you could be potentially taking fluff into your theatre. So just, yeah, we didn't used to allow bedding in our theatres, but then there's that discussion around, you know, patient warmth and that sort of thing, which again we're going to come on to a little bit later. We've sort of been through cleaning, when to use detergent and water. Now, think about your high touch objects. So things that we have in our practices, and this can be anywhere, this isn't just in the operating theatre, but what would you consider to be like a high touch area in your practice? Yeah.
Door handles.
Door handles, yeah. Do you guys have any protocols for cleaning of those? Yeah, some of you do, some of you don't. Okay, so think about those high touch areas, and as I said, this isn't, you know, this is kind of moving away to the practice as a whole. But yeah, things like phones, computer keyboards, light switches, door handles, things that people are touching all the time. Maybe having some sort of routine in the morning and in the afternoon to just give those a quick clean over. But also there's one of the areas that I used to be a bit mindful of was things like cleaning around sinks and maybe the areas where patients aren't actually in contact with. So in our prep areas, we used to have 2 sinks at either side, and some people used to clean those sinks with disinfectants. And this is my personal opinion, I used to think that that was a little bit unnecessary and that maybe a detergent on there was a little bit better, because actually those sinks probably aren't going to have that much bacteria because the patients aren't going anywhere near them. I guess you could say that the taps are a high touch area, but I worry a little bit about resistance to disinfectants and things. So I changed the protocol so that we were using detergents around the sink, and I looked at some human stuff, and actually in human hospitals they use detergents quite a lot for cleaning rather than just disinfecting everything. But that was kind of something that I just looked into because it was just a bit of a concern of mine around you know, cleaning with disinfectants all the time. And then talking a little bit about sterilisation. Now, I haven't got too much about sterilisation in this lecture because to me, it's kind of like a whole other lecture in itself. In your notes, there's some notes around sterilisation of sort of instruments and things, and you know, when we might not be able to perhaps autoclave something because it might melt. What can we do? Like things like ethylene oxide, cold sterilisation. So there's some notes in your packs about sterilisation as well.